One of the biggest questions I get asked a lot is what's the best thing I can do for my health? What they really want to say to me as a cardiologist is, how can I prevent a heart attack from happening? How can I prevent heart failure from happening? In this video, we're going to be talking about what are the biggest risk factors when it comes to heart attacks and heart failure, and if you treat those now, our goal is to prevent you from having to see me because you've had a heart attack, heart failure, etc. My name is Dr. Isang, and I use this platform to be able to discuss the importance of heart health and prevention. So let's get into it. Heart attacks, heart failure. Other name for heart attacks is myocardial infarction, plaque buildup, atherosclerosis. They all mean the same thing. And a lot of people have it in their 50s, 60s, and 70s. So yes, being older increases that risk, but there are also modifiable risk factors associated with heart attacks and heart failure. That includes things like high blood pressure or hypertension, hyperlipidemia or high cholesterol, insulin resistance, diabetes that is uncontrolled. So if you don't have those under control, you're putting yourself at risk of having a heart attack. One of the bigger things that doesn't get talked about enough is the importance of exercise and nutrition. So obesity plays a huge factor because if your weight is uncontrolled, can lead to things like sleep apnea, can lead to risk factors such as high blood pressure itself. So understanding that your weight plays a huge factor. In fact, weight, diabetes, uncontrolled hypertension increase the risk significantly. So if you can treat this, if you can attack this, hopefully you won't have to be seeing me. I should probably walk on the other side of the road. I almost got ran over. That way at least I can see the cars coming. And by the way, I am walking with a 20-pound weight, and it is disgusting. I typically walk with a 12 or 16 and wanted to challenge myself to the 20, but I'm not ready yet. So in the future, I'll have to bring this one back down. I was feeling like Goku, trying to put on all this weight to reach Super Saiyan mode. But let's get back to what we were talking about. Yes, treating the risk factors will significantly reduce your chances of having a heart attack or heart disease, but also understand that it's going to decrease your risk of having things like kidney failure, needing to be on dialysis, needing to be on a transplant. If you reduce the risk of strokes, also reduce the risk of having dementia, type of vascular dementia from people who are having small strokes throughout their whole lifetime. Like I've said, risk factors includes hypertension, hyperlipidemia, diabetes, a strong family history, smoking, poor nutrition, insulin resistance, obesity. So attacking those is the best way to help prevent a heart attack from happening. But like I also said, there are some things that you cannot control. You can't control getting older, which is a risk factor. You also can't control your genetics somewhat. If you have a propensity in your family members of people having a heart attack, it may just increase that risk for yourself too. But that's where coming and having those discussions with your family members is very important, because if that risk is secondary to something like familial hyperlipidemia, you can be started on nutrition to help decrease it, statins to help decrease it, and sometimes injectables, PCSK9 inhibitors, Leqvio, can be utilized if your cholesterol level is not at goal and you have significant family history of heart disease or atherosclerosis. I challenge anyone who thinks that it's easy to walk up a hill while wearing a 20-pound vest to do it, and then let me know. It's a lot more difficult, but also haven't been doing enough cardio, so I'm a little bit of an amateur when it comes to this, but yeah, don't just lift weights. Hit some cardio in there too, because a good and happy heart is one that is able to withstand all the stressors that the body can be thrown at. So start incorporating more cardio. That's more of a lesson to myself and anyone else who only lifts weights and doesn't put enough cardio in to their exercise regimen. But don't get me wrong, there are some benefits, significant benefits when it comes to strength-based exercises with weights, in decreasing osteoporosis, especially as we get older, and especially as in women as they undergo perimenopause, menopause. Lift weights, but also incorporate lots and lots of cardio into it. Now, as I finish this 20-minute walk with my weighted vest, One of the biggest things that people need to understand is, unlike diabetes mellitus, where if it's uncontrolled, you start having symptoms such as your poor wound healing, some neuropathy. People who have high blood pressure or high cholesterol, a lot of times they don't have any symptoms. And they don't have symptoms until they've had a heart attack. So this is why it's extremely important to also, in attacking this, understand that you could be having the risk factors right now and you don't know it. Why? Because you haven't been seen and treated for it. It's important to always follow up with your medical provider, at least on an annual basis, to get all of these worked up, because they'll check your blood pressure, they'll check some labs on you, making sure that you're not at risk of having heart attacks in the future, not at risk of having heart failure. If you're at risk, we'll start doing appropriate tests, echocardiograms, EKGs, stress tests, to put you at ease that you're not gonna have an event that was unexpected. So remember that a lot of these conditions are preventable. There are some modifiable risk factors, things like your blood pressure, things like your cholesterol level. Also understand that there are some things that are not modifiable: your age, genetics, strong family history. All of this ties into following up with your medical provider, at least on an annual basis, to get it treated, get it seeked. Remember that a lot of times people won't have any symptoms until they've had their first stroke, until they've had their first heart attack. It's Dr. Isang. Any comments? Any questions? Leave it in the comments. Peace.